Hi everybody and welcome to this week's episode. My name is Dr. Linda Nyamute and I'm a consultant psychiatrist. This is the mental sphere with all things mental health. So this week we're going to discuss a relatively common question that I get asked very often, and that is, what is the difference between a psychologist and a psychiatrist? And do I need to see a psychologist? Do I need to see a psychiatrist? Where do I start? And how does each one of these specialists benefit me in my mental health recovery journey? So stay tuned and tune in. Alright, so to just begin, we'd want to acknowledge that both the psychologist and the psychiatrist are mental health specialists who work together to offer you a continuum of care in your recovery journey for whatever mental health illness that you may have been diagnosed with. So the first thing that we'd want to talk about to help us understand the differences is the education background, or rather the primary degree. So for psychiatrists, this is a medical doctor who has done medical training in medical school and internship, and then a further specialization in psychiatry and mental health. Psychologists, on the other hand, have had a background training in psychology and a further training in clinical psychology to just help them understand human behavior and mental illnesses, but they are better trained with our talk therapies. So the next difference we are going to talk about is when it comes to the job description. So as we mentioned earlier, psychiatrists are medical doctors with a medical training. So you'll find the primary role will be to address the biological nature of the disease. And by this I mean when it comes to medication and how they can just alleviate the symptoms, the physical symptoms that you may be experiencing as a result of your mental illness. So they are the ones who will be doing your prescriptions all the time. So psychologists, on the other hand, will address the psychological nature of the illness, and this will come very much in handy with our talk therapies. So there are very many different types of talk therapies depending on your diagnosis, depending on the kind of challenges that you've gone through. And so therapy is very beneficial in terms of just overcoming a difficulty, understanding or accepting an experience that you went through that was probably very traumatizing. And it also helps to change our thoughts and our behaviors and just understand and undo harmful repetitive patterns that we have adopted throughout the years. So the other difference we want to talk about is when it comes to the timing of the sessions. So when you get to see a psychiatrist, your initial visit may take anywhere between 45 minutes or 40 minutes to an hour. Normally it will not exceed past an hour, but subsequent visits are usually much shorter. They can last anywhere between 15 minutes to even that 1 hour, depending on the kind of challenges that have to be dealt with during that visit. So if it's just a refill of a prescription, or if everything is okay and there's nothing much to focus on or talk about during that visit, then it may not take as long. But if there are quite a number of challenges, maybe there's a new traumatic event that you've gone through since the last visit, then it may take a bit much longer. So sessions may vary in terms of how long they take from one visit to the next visit. But psychologists, on the other hand, will have a bit more of a structured session where you'll find your sessions are the same time from visit to visit to visit. So the length of session 1 and the length of session 12 will tend to be the same amount of time. So this usually is about 15 minutes to 1 hour per session. So I've just outlined the main differences between a psychologist and a psychiatrist. Just the other thing to add is there are people who have specialized again further to deal with either children or addiction. So you'll find someone is called a child psychiatrist or a child psychologist, that's because they have specialized to deal with children. I mean, the difficulties and the kind of language that you have to use with children may be a lot different from that you'll be using with adults, which at times may be very crucial. Not at times, actually, all times may be very crucial in terms of just moving forward and getting results from your therapy. There are also addiction therapists and addiction psychiatrists. I mean, to deal with people who have addiction issues. So forensic psychologists, forensic psychiatrists, the list goes on and on and on and on. So there's another group of mental health specialists that we've not talked about, and that's the counselors and the crisis intervention therapists. And for the counselors, they primarily provide a supportive role, and they help in times of a difficulty where you're like, I'm having this problem and I need help to solve it, and sort of here and now solution-based sort of therapy most of the time. And for crisis intervention therapists, is basically to just help in times of crisis. It can be anything from a terrorist attack to a road accident, to just help you understand the traumatic event or the crisis that has just happened, and dealing with the emotions that come with that, to prevent development of mental illness in the future as you recover psychologically. So very many people tend to be very skeptical about entering a psychiatrist's office for just the mere reason of stigma behind it. But it is very necessary to know that at times you may be in need of a psychiatrist's help more than a psychologist. Sometimes you need a psychologist's help more than a psychiatrist. So generally, there's no rule of thumb where to start. And why I'd say that is because, as we mentioned earlier, psychiatrists and psychologists work together, and even if you land in the wrong office, they're able to refer you to the right office. So when it comes to issues like overdose, someone who has an addiction problem or has taken too much alcohol, for example, it will be very important, even if they'll have to do therapy later on, to see a psychiatrist, at least in the initial phases of treatment. If you've been having sleep issues, sleep difficulties, insomnia, hypersomnia, or you're feeling very restless and anxious and can't sit still and you're overly over the edge 24/7, you may need to see a psychiatrist before you go for therapy. For someone who's been having hallucinations, and that's just basically where you're having a sensation where you're seeing or hearing things that are not necessarily present, that it may be important to see a psychiatrist before you see a psychologist, for the simple fact that it will be very difficult to engage with your therapist if you're not in real time, if you know what I mean. That if you're very suicidal or just had a suicidal attempt, it would also be very important to see a psychiatrist, and primarily because a lot of suicidal cases are associated with severe mental illnesses, and many severe mental illnesses most of the time will require medication. And then if you've been in therapy for a very long while and it doesn't seem to be helping you, don't seem to be improving, it may be time that you knock on the psychiatrist's office. Yeah. Overall, as I said, doesn't matter where you begin. The important thing is you have taken a step to seek help, and that's all that matters. Just that initial step. Then everything thereafter will open up Pandora's box, and you'll be able to be assisted in your mental health recovery journey. Yeah, and so that's it. Thank you for tuning in. Thank you for watching. We've talked about so many things in very many different angles. If you have any questions, or you don't tend to disagree a bit with some of the things I said, or any comments, you can drop them below in the comment section. And yes, see you next week, and don't forget to subscribe. Cheers. Time out.